after it was reported that more than 500 people nationwide have contracted supposed vaping-related illnesses, 5 of whom have died in Massachusetts. Governor Baker has revealed the country's most extreme measure yet.
I'm requesting that the Public Health Council order a 4-month temporary ban on the sale of all vaping products in retail establishments, online, and through any other means effective immediately.
The governor's ban has been met with a mixed reaction after more than a dozen shops in Massachusetts are facing the imminent threat of having to close down for good. Mike Siegel, a Boston University School of Public Health professor of community services who specializes in tobacco control, believes the government is attempting to scapegoat the stores in order to fix a vague crisis.
I think this is really a public health disaster. I think that it's going to, first of all, we now know that the primary culprit in these respiratory illnesses is not electronic cigarettes, but black market THC products that people are vaping. It's not products that are bought at stores. It's products that are either bought off the internet or that are bought from essentially from black market sources off the street. And so banning the sale of vaping products at stores is not going to solve this problem. It's not going to put a dent in the respiratory disease outbreak. In fact, I think it's actually going to make it worse, because what's going to happen is when these flavored e-liquids are no longer available, kids are just going to switch over to using the THC liquids. I don't think that youth really are that concerned about what it is that they're vaping. I think the idea of vaping itself is attractive to them, and I think they're just going to vape whatever is available. And if what's available are THC vapes, then that's what they're going to use. And so I think we're actually going to see an increase in the number of cases rather than a decrease.
On the flip side, Dr. Swanee Jett, Director of Health and Human Services in Brookline, agrees with the governor's actions and calls them a life-saving move.
It's a good precautionary step until we have more evidence on which particular products are causing some of the cases that have occurred.
For now, Dr. Jett urges the public and stores to remain patient and wants to remind them that this is all being done for the greater good of the Commonwealth.
Well, I would say, one, this is done to make sure nobody dies from a product. Two, to remain patient until we can really find out the source. And, you know, I do understand that they're losing money from a product that is legally and able to be sold, but until we're able to reduce the amount of occurrences that has happened, I just beckon them to be patient.
Mm-hmm. While we do not yet know what the outcome of this health crisis will be, it was reported that last Wednesday, local boards of health were beginning to enforce the new ban, and other states have already followed suit. The day after Governor Baker announced his new policy, Governor Gina M. Raimondo halted the sale of flavored vaping products in Rhode Island. In the next coming weeks, the Trump administration is expected to release their own plan for removing flavored e-cigarettes and nicotine pods from the market. This comes after public pressure for federal regulation. However, no details have yet to be established. For Boston University News Service, I'm Kaylee Felsberg.